I'm Dr. Samuel Acuff, research scientist at the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. I'm here with Dr. David Eddy, who's the Associate Director of Clinical Translational Recovery Science at the Recovery Research Institute and an assistant professor at Harvard Medical School. How's it going, Dr. Eddy?
Well, glad to be here.
Glad you're here and glad we're talking about this particular topic, recovery coaching. This is an exciting, fairly new tool that's available for people who are in recovery. So can you tell us a little bit about what recovery coaching is?
Sure. Well, recovery coaches, sometimes referred to as peer recovery support specialists, are people who, by way of their own lived experience with addiction and addiction recovery, are experientially qualified to support people on their own recovery journey. Now, of course, they get additional training as well, but they can bridge some pretty important gaps in the continuum of care.
Yeah, this is a really interesting, I think, service because it sounds like through lived experience, but also all of those extra skills that they acquire specifically for this role. And so what kind of services do recovery coaches provide?
Well, recovery coaches can do a lot of things, and they can do a lot of things that a licensed professional can't do, which is important to know. So one of the most important things peer recovery support specialists or recovery coaches do is help connect people to formal treatment. So sometimes they work in emergency departments, for instance, and their job is to help identify people coming through the emergency department who have a substance use disorder related injury or a medical problem or psychiatric problem, and help engage those individuals in care. They also work in the community, though, helping people connect with existing community recovery support services like mutual help programs. And also they can bridge people between levels of care. So when people are transitioning, for instance, from inpatient to outpatient care, they can potentially cover care gaps and help ensure people stay the course in recovery during those important transitions.
Yeah, it sounds like a critical component, actually, of sort of step down or even just sort of filling in the gaps in care that a lot of these people might need. So what do we know about the benefits of recovery coaching?
Well, actually, there's been quite a lot of research on peer recovery support services and recovery coaching at this point. I mean, there's still more work to be done, but to date, there's been about 35 studies published in peer-reviewed journals. So we're starting to get a better understanding of what recovery coaches can do and the kinds of supports they can offer and the evidence base for that. So we know for sure that recovery coaches can help improve substance use outcomes in people, especially in early recovery. And we also know from that literature that they can help connect people to treatment and help them stay engaged in treatment longer. Now, those papers that I mentioned have also looked at other outcomes, but these many other outcomes have been less well studied, so we have less data at this point. But we're really confident peer recovery support services can help people reduce or stop substance use and also help them engage and stay retained in care.
Yeah, it sounds like a great resource. And is this something that's free, or is there any cost to engage in recovery coaching?
Typically, people receive recovery coaching through the clinic or healthcare service provider that they're engaged with. So if you're in inpatient treatment, you might interact with a recovery coach, and there would probably be no additional cost to you, certainly none that you would see. Similarly, if you're engaged in outpatient treatment for substance use disorder at a clinic, for instance, you might have a recovery coach who's complementing the work of your psychotherapist and perhaps prescribers, maybe a psychiatrist. You're probably not going to see a bill there either. Now, if you're in the community and you're seeking recovery coaching through maybe an individual who has some form of private practice, there could be a cost associated with that.
This has been a really helpful overview of recovery coaching. I appreciate it. Where could someone go to maybe find out some more information about recovery coaches?
Yeah, there's no singular association, national association of recovery coaching, at least not yet. But if you Google recovery coaching or peer recovery support services, you will find a lot of information. And of course, on recoveryanswers.org, we also have a tremendous amount of information about recovery coaching there.
Great. Thank you so much.
Thanks.